Hello, I'm Sun Youngwee from eGood Dental Clinic. Today, I'd like to share a case of a 50-year-old female patient. As you can see, there are only 3 teeth left in the maxillary anterior region. Teeth number 14 through 17 and number 23 through 27 are all missing. And there's pretty severe pneumatization in both sinuses. On the CT, number 14 site looks fine, so implant placement itself shouldn't be a big issue. But the bone is a bit thin around the platform. Toward the posterior region, the vertical bone height is severely limited. So in cases like this, I usually go with a lateral approach for sinus grafting. But, in this patient, the vertical residual bone height was only around 3 mm at best. So, I plan to place implants only at number 14 and 16. For that reason, doing a full lateral sinus graft felt a bit excessive for just one posterior implant. That's why I decided to use casket and go with a crestal approach to lift the sinus floor and do the graft. As for number 14, I expected only a very thin buccal bone would remain after placement. So I plan to do a simple GBR there. This is the preoperative intraoral view. The soft tissue looks fine with no major issues. The extraction socket at number 16 hasn't fully keratinized yet, but there's an adequate amount of tissue. As I mentioned, I'm planning to place implants for number 14 and 16. I'll do a sinus graft for number 16 using a crestal approach, and also some buccal augmentation from number 14 to 16. Now, let's watch the surgery video.
1년 뿅. 오케이. 그러면 안 돼. 동영상 어떻게 보셨는지
What do you think?
궁금합니다. 술중에 제가
I'll explain as we go through the photos from the surgery. Here's the preoperative status. I opened a flap and saw that the alveolar process and the drilling bed were uneven, which I already expected. Since number 16 was likely extracted due to periodontal issues, the site was quite depressed. I placed the implant at number 14 first. As you can see, there's a depression right behind number 13, so I performed an augmentation there. At number 16, I used cast kit to lift the sinus floor and did the graft. Just a small amount. And for the augmentation, I used EOS collagen. It is true that EOS collagen is a graft material. Many reports show that it serves the same purpose as other graft materials, and it works perfectly fine. When we expect a lot of remodeling, or there's not much residual buccal bone, and when the defect itself is a non-contained defect, in other words, a situation where particulate material cannot maintain its shape, a block-type collagen graft like this can be a good option. I didn't do anything special. I just added it. But when you are placing it, if you fold it over, the shape can change, so you need to contour it to the shape of the defect. This is a bit controversial. Some say they do it, and some don't. Well, I do. But most of the time, I use a membrane.
아무래도
With a membrane, there's less soft tissue impingement and ingrowth.
그래서 그 연조직이 이제 쉽게 말해서
In my experience, it also reduces the amount of bone resorption and remodeling.
고래 흡수량이나 리모델링 양도
So, even if it requires extra effort and cost, I try to use a membrane even in simple cases like this.
하기 때문에 좀 수고스럽고 그리고 비용이 좀 들어간다 하더라도 저는 멤브레인을 쓰는 쪽이고요. 이렇게 심플 오그멘테이션을 했을 때에도 그리고
That's it for the surgery.
술 후에
Here is the post-operative panoramic radiograph.
4번은
I placed KS and TS implants at number 14 and 16, respectively.
CT상으로 보게 되면
On the CT, you can see that number 14 has been augmented on the buccal side. At number 16, the implant has been placed completely within the bone housing. You can also see the graft material inside the sinus, with the membrane elevated.
사이너스 멤브레인은 다음과 같이 디태치가 되어 있는 것을
You could lift it further if needed, but I prefer to elevate only as much as necessary.
필요한 만큼 하는 게 더 낫다고 생각을 합니다. 보시다시피 저희가 하이드롤릭 프레셔로 사이너스 플로우를 엘리베이션 하는데 보통은
When using hydraulic pressure, the anterior side doesn't elevate as easily.
머티리얼이 들어가 있습니다. 자,
In the posterior, on the other hand, it lifts much more readily.
우리가 수압 거상을 했을 때는
So, you'll find you get a lot more lift in the back than in the front. In fact, if you keep adding grafting material, it could practically go on forever. That's why it's important to use the right amount.
싱글 기준으로 했을 때는 제가
For a single implant, I think 1 cc should be enough.
cc 정도
That completes the implant placement.
생각을 합니다. 자, 이렇게
For this case, the loading timing depends on the number 16 implant.
6번 임플란트
Since I'm a bit on the conservative side with loading, I usually wait at least 4 months and decide based on the ISQ values. I'm still following up on this case.
식립 후에 최소 4개월
Hopefully, I can share an update after prosthesis delivery.
시기를 잡을 것으로 저는 예상을 합니다. 이 환자는 아직 팔로업 중에 있고요. 나중에 보철이 완성이 되면은 말씀드릴 수 있는 기회가 있었으면 좋겠습니다.
That's all for today. I'll be back with another case next time. Thank you.